The state is moving out of its COVID-19 emergency response phase and into the disease management. But that does not mean that we're out of the pandemic just yet. And joining us on live to talk more about this is Dr. Scott Miscovich of Premier Medical Group Hawaii.
And Dr. Miscovich, thank you so much for your time. So what are your thoughts on the state's announcement today?
Well, it's a mixed message. I think the state was almost kind of forced into making this announcement today because actually it's all flowing down from the federal government. And, basically the funding from the federal government for, saying that there should be an emergency with the pandemic, it's just shutting off. And they're basically turning to the states and saying, now it's up to you. And so, we had a mixed message on the press conference today where I really want to give a shout out of positives to Director Libby Char and Dr. Sarah Kimball, who were great. They were very honest and they just told it like it was. The governor just kind of basically was just reiterating some of the words coming from the federal government. But it's not a pandemic right now, it is a pandemic right now. We're not out of the pandemic, and there still is major concern.
And that leads us to our next question. Dr. Anthony Fauci today said that the U.S. is actually out of the pandemic phase, but clearly you disagree with that.
Oh my gosh, every epidemiologist in the world, every public health expert in the world is just rolling their eyes right now and just saying, how can you even say that? By definition, everything that's happening right now, the world is still in a pandemic. And what is a pandemic versus an endemic? Well, an endemic is one regional area where disease might spread. A perfect example was Ebola. Ebola broke out in Africa. It was contained with Africa. It spread to some countries around. Well, that was endemic to that area. Well, right now, South Korea, tell the people in Beijing who are going to be locked down for a month, tell the people in Germany, which still have 100,000 positives a day, or Italy with 70,000 positives, or Japan or South Korea, all over the globe, we're seeing this disease is still now picking up and increasing, and there's massive uncertainty still of whether there'll be another major variant or not. So this is fully a pandemic. And Dr. Kimball was so correct because she used the formal definition that we have another year minimum before we're going to be able to determine whether we're out of the pandemic. So people, please hold on to those masks.
Okay, Dr. Miscovich, we're entering graduation season pretty soon. And, it's been in the headlines lately about some schools deciding maybe not to allow lei giving on graduation day. And here in Hawaii, it's part of our tradition. So what are your thoughts about lei giving and should people be doing that?
That's, from my standpoint, I would only put one word to it. It's outrageous that we're using a pandemic to take away something that is so much built into our hearts and into the tradition of Hawaii to be giving a lei during graduation. So as a public health projection, is giving a lei going to increase the amount of COVID? No. I see no reason that this is going on, and strongly disagree to take away something that is so important to our culture. But also, let's look from a public health standpoint. What data are we seeing now the last 6 months? The psychological effects to our kids has been tremendous during this. Let's not take anything else away from them. Let's allow them to have a pleasure that has been generations before them.
And you had mentioned masks earlier, and some people might feel comfortable wearing them, some people might not feel comfortable. But so what do you think about travel? Should people be masking up, especially on planes and buses and things like that?
Oh boy, absolutely. Indoor environment equals mask. The data in airplanes is very crystal clear. If you are 2 to 4 rows around someone that is positive and you're not wearing a mask, you have a really high likelihood that you're not going to get it. If someone in row 10 has the disease and you're in row 50, of course you're not going to get it. But then there's the passing in the airport, passing in the indoor environments. Boarding a plane is a very important time. Some of the data of the air quality in a plane when all the filtration is not fully on is concerning. Just be safe, wear your mask. You're not going to have as much risk inter-island, but the longer the duration of the flight, the higher the risk. So wear your mask, just be safe. Just get used to it if you want safety.
Okay, doctor, we have Mother's Day coming up. A lot of folks are going to be getting together. Just some of your advice?
Yeah, I mean, I've been working with you guys here on the show now for 18 to 20 months, and it still is not going to change. If you have mom or family members that have moderate high risk, separate them, be outdoors, pay attention to the ventilation. If you're outdoors and you keep separated, enjoy. You can have a big get together if people are outdoors and we have these beautiful trade winds we've been having. If it's going to be indoors and you don't have good ventilation, wear masks. You're doing it to protect your kapuna. You're doing it to protect your mom. So it goes back to that indoor, outdoor, and be very careful if mom or family members have medical high risks. You may want to reduce the size. And if you really have someone at high risk, whether it's cancer or chemotherapy or something like that, use some of those home tests and have people get tested before they come over and visit. But yeah, no, we should still be able to hug mom if you take those precautions.
All right, perfect. Well, Dr. Scott Miscovich, we really appreciate your time tonight. Thank you so much for stopping by, as always.
It's good talking with you all again. Thank you.
Have a great night.